Excited to participate in the SOHO meeting. This is always a wonderful meeting, and despite everyone's genuine desire to have that be its usual wonderful event in Houston, will be an online offering. But I suspect, like other meetings, will allow a broader group of participants than in the past because of removing the limitations of geography. I'm presenting a presentation at the meeting. Fedratinib elicits spleen volume or symptom response in a majority of patients with intermediate or high-risk myelofibrosis, results from the JAKARTA and JAKARTA-2 study. And what we did was we looked at individuals that truly had an adequate test of fedratinib, having received 6 cycles or more. And what we identified was in the JAKARTA study, 70% of the patients randomized to fedratinib versus only 47% with placebo had, they both had assessments, and then overall 76 of the fedratinib treated patients achieved a spleen response or a symptom response, including 24 patients or 36% who achieved both responses. So again, like many of these sorts of trials, if one looks at solely the intention to treat analysis, you don't really get a sense of what is the benefit in the patient who's on the therapy for a longer period of time. And with fedratinib, that is relevant because a clinical hold did interrupt the longer-term follow-up on these studies, so it may have really led to an underestimation of the cumulative benefit. In the JAKARTA-2 study, we saw that 81% of patients who received 6 months or more had a spleen volume response. That was at 57% total in that group, or 48% in a symptom response, and 24% who achieved both of those responses. So the takeaway was in individuals who receive a full 6 cycles of fedratinib, the response rates are very, very solid, both in the frontline and second-line setting, and certainly help to further support its indication and use in both of these settings.